but hoping I can get back on later on. Just wanted to thank everyone again for joining us and remind everyone that our seminar is held on the 2nd and 4th Mondays from September through June, and includes speakers with work focused on child health from UCSF, as well as guest speakers. And if you are interested in speaking or know anyone else who you'd like to suggest, please send me an email. We have our final speaker before the summer next session, which is on June 26th, and that will be Dr. Marcia Treadwell from the Division of Pediatric Hematology. So we're also looking forward to that. We're still virtual and using Zoom, so we ask that you stay muted unless you have a question, and we'll open it up to questions at the end. Today, we're welcoming Dr. Paul Krezanoski from, I probably said that wrong, I apologize, from the Division of Hospital Medicine in the Department of Medicine at ZSFG. Paul is an associate professor of medicine and pediatrics. He's med-peds trained and previously served in the Peace Corps in Madagascar. He invented SmartNet, which is an electronic Bednet adherence tool, which he's currently testing in Uganda. And he just told us he is actually in Uganda and has been living there for a little while. So that will be great to hear his experience. His prior work has also focused on malaria prevention, and his research is currently funded by NIAID. The title of Paul's talk today is Bednet Use Monitoring to Improve Malaria Prevention in Uganda. Thanks again for joining us.
Great. Thank you, Roberta. Yeah, I'm very excited to be here. Thank you for allowing me to join. As I said, I am calling in from Uganda, so I'm going to turn off my video, but obviously keep the screen on just to save some bandwidth. So yeah, great. So that presentation was mostly everything you need to know about me. I've been at UCSF since 2016, med-peds trained. I still practice both adult and pediatric medicine. And I'm going to talk today about bednets, essentially, bednet use to how bednets can help improve malaria prevention. And I'm going to take you through some of my research and how I approach this. So first, some disclosure statements. I'm the founding director of a very small nonprofit organization called Opportunity Solutions International. They've funded some of this research, some of the SmartNet research that I'm going to present today. It's just important I let you know that it's very non-remunerative position, but it's something I have to tell you. In addition, I did invent a tool that's used for bednet use monitoring, also not very remunerative, and I do co-own some intellectual property in this, but I'll tell you as I present that tool, kind of the current status of it. So I'm going to give a quick outline of what I hope to talk about today. So first, I want to talk a little bit about malaria and bednets, give kind of the current state of malaria in the world, talk about the conceptual framework sort of behind my research, talk about some studies that I've looked at, trying to understand factors that affect ownership of bednets for the prevention of malaria, and then get into talking about how we try to measure and how we think about bednet use, and then talk about some tools that I've used for trying to monitor bednet use to better understand how people use these tools, and talk about some future avenues for research. So first, malaria and bednets. You may know some of this, but as of the latest WHO World Malaria Report, 2021, there are almost 250 million malaria cases and about 620,000 deaths worldwide. Malaria, the general picture is that malaria had a significant reduction worldwide from about 2000 to 2015. But since 2015, prognosis has essentially stagnated, or in some cases worsened. And we, in particular, in sub-Saharan Africa, where I do my work, today, 95% of all malaria cases in the world occur in Africa. And important for this group is that malaria is most dangerous in children, which we also probably know. But 76% of deaths from malaria occur in children that are under 5 years of age. And that proportion really has not changed over the last 6 years. And so in terms of risk and impact, children under 5 are still a very significant group. And also pregnant women are another traditional group that we look at as well, mostly for the risk to the mother and to the child as well. So those two groups are obviously relevant to a pediatric audience. So what are bed nets? What are these long-lasting insecticide-treated bed nets? So essentially, these are mosquito nets that are unfurled around a bed that people sleep under every night. And the idea is that they provide protection against mosquito bites. The original studies in the 1990s, these are controlled trials, showed anywhere between 18 and a 23% decrease in child mortality. So a very effective tool. And it's been estimated that nearly 70% of the reduction in malaria incidence that the world saw between 2000 and 2015 was a result of widespread distribution of these insecticide-treated bed nets. So last year, there were 220 million bed nets that were distributed throughout the world. Every country that is endemic with malaria has a bed net program, essentially. And the WHO has called for all 3.2 billion people worldwide, and that was about 10 years ago. So there's more people nowadays who are at risk of malaria to have access to bed nets. And it's essentially the standard of care, one bed net for every 2 people throughout anywhere that's at risk of malaria. So bed nets are a very widespread health prevention tool. So how do these LINs, these bed nets, how do they work? So there's 2 basic mechanisms of action. First, the most obvious is that they provide an individual protection. So the person sleeping under them is protected from getting mosquito bites. They also provide a repellent effect. Mosquitoes will arrive, and when they are interacting with the insecticides that are on the bed nets, they can either be repelled and just kind of not want to be around there and fly away, or they actually will take enough of the insecticide off the bed net and actually die. So that's how they can provide protection to the individual or individuals that are sleeping under the bed nets. In addition, one of the most effective parts of bed net distribution was the fact that they provided a community-wide vector control. So the insecticide on the bed net would knock down enough mosquitoes so that there'd be fewer mosquitoes, fewer vectors for malaria overall in the community, or overall for the person sleeping in the room next to you in the same house. So there are 2 basic mechanisms of action. We're not going to talk a lot today about insecticide resistance, but there are, insecticide resistance is a growing problem, and my research is mostly on factors that affect individual decisions about owning a bed net, either purchasing or going to get a bed net, and whether you use them or not, and how you use them. So here's the kind of conceptual framework for my work. My mission statement is I'm trying to deepen my understanding of bed net use behaviors, and the idea would be that then we can try to design more effective interventions around bed nets to protect children from malaria. And to do that, we need to kind of address 2 important questions. So number 1, what factors affect ownership of bed nets? How do we get the bed nets from these large warehouses, in the center of the country after they've been, delivered? How do we get them into people's homes so that they have them to use if they're so inclined? And then number 2, which is an interesting question of behaviors, is how do we get people to use the bed nets, and how do they use them regularly? And number 2 here is crucial. I mean, dropping a bed net or dropping 10 bed nets off at everyone's door is not enough to actually prevent malaria. We have to have people understand why they're using them and then use them regularly to actually protect themselves and protect their families. So what I'm going to do is I'm going to talk a little bit about a couple research questions that address number 1 here, the ownership of bed nets, and then we'll move on to kind of addressing number 2, which is how we understand and how we get people to use the bed nets. So first, how can we get bed nets into houses? So one potential barrier to that might be malaria knowledge. Perhaps people don't understand how malarial fevers are transmitted, and so they don't understand that bed nets are one potential way to prevent that. So we could perhaps do some education projects to teach people about how malaria is transmitted. And I've done some work in that area. Availability, perhaps people aren't able to get bed nets. There's just not enough around. And so maybe we can design better delivery systems to help bed nets be more available. Another one is cost. So, back in the late 90s, early 2000s, when I was doing some of my initial work, there was a big question about whether bed nets should be given out for free to everyone, or whether we should actually charge a small price and create a market for bed nets. And so I'm going to talk first about a study that I ran, actually began while I was a Peace Corps volunteer in Madagascar. And this study was a randomized trial in 12 villages in rural Madagascar, about 350 houses. And what we did is we randomized these villages to different prices for the bed nets. And the idea was try to look at how the demand for the bed nets would change and how the actual use of the bed nets would change based on the price. And if you can see bottom left here in that table, prices were anywhere from free. So we gave everybody, each household got one coupon that they could redeem for a bed net, anywhere from free bed nets all the way up to market price. And at that time, it was about $2.50. And in Madagascar at that time, the average median household was, the average household was making $1 a day, $1.50 a day, being one of the poorest countries in the world at that point. So $2.50 is a fair amount of money, and well, I'll show how the demand changed with the price. So at baseline in Madagascar, this was in 2004. In this area of Madagascar, which is in the Central Highlands, only about 4% of households actually own bed nets, and only 1% reported actually using them. Nowadays, that would be seen as a very, very low coverage of bed nets, and coverage has increased even in Madagascar by nowadays. But the interesting thing was that, as expected, the price of the bed nets that we were giving the bed nets out for had a significant impact on whether people own the bed nets, meaning that they had to take that coupon that we provided them, go to a central location, and they could redeem it for a bed net at that cost. So 100% of the households got them. 100% of the households that had a coupon to get them for free went and redeemed the coupon, unsurprisingly. But then you can see a nice decline, a very regular decline, down to only 5% of the households that were able to buy them at the market price at that time actually redeemed their coupons. So the bed nets were in demand, but it really depended on the price that you were charging. And so the price, clearly a market price at that time, was probably too high if only 5% of people were willing to pay for them. So this is a chart of that same data. And so what we're looking at here is the dark blue is the demand for ownership of the bed nets. And then what we've added on here is the use of the bed nets. So you see the pink line, and a really interesting sort of discordance. So this is a phenomenon that's well known in literature and health prevention around bed nets in particular. Sometimes giving products out for free can demean their value in people's eyes. And one potential suggestion of that might be that what we saw was a significantly less use of those bed nets, even though 100% of the households that were able to redeem them for free redeem them, only about 53% or something were actually using them. And actually around 1,000 Ariari, which is, I think about 30 cents, 40 cents, those people, the ownership and use is a little more in accordance. So this was an interesting study that in subsequent studies, they have decided that essentially providing enough bed nets for free can overcome some of these biases. And then if you couple that with education, you can overcome some of the potential negative biases that can occur when you're providing products for free. But initially, this study was suggesting to us that perhaps a small price and a nominal price might be, and a nominal cost might be a good idea in order to induce people to see the value of the good that was being provided. So our group, after doing that study, we went on to the next study of looking at ownership and use of bed nets. And the next idea we had was perhaps we could use incentives. So instead of a cost, it's actually a positive price. That we could provide a prize or a small reward to households if they were using their bed nets. So that created a second study. In this study, again, we did this in Madagascar. At that time, behavioral incentives has been, and nowadays it's been well researched. At that time, it was mostly around weight loss, tobacco cessation. We could obviously add on here things like vaccines, COVID vaccines, and things like that. In those days, developing countries, there was around immunizations, nutrition, all of these different areas where people would provide behavioral incentives to try to help lower the barriers for people to behave in a healthy way, quote unquote. But at that point, no one had really looked at the effect of behavioral incentives to encourage the use of bed nets. So a few years after, so I was in medical school, ran another randomized controlled trial in 21 villages in Madagascar, about 520 houses. And it was a very simple, a randomized trial where we had an intervention group that, essentially every household got one coupon for a free bed net that they could redeem at the local market town. But the intervention households were additionally told that if they returned to, if they were using their bed net at some unannounced time in a 1 month, they would receive an unspecified bonus. We'd give them a prize if they were using their bed net when we came back in about a month at an unannounced time. Importantly, these villages, every village was randomized, so there was less risk for crossover. Households were randomized similarly to neighboring households in the same village. So the results of this study were interesting. So essentially, in the bottom left here, near the origin of this chart, you can see 6.1% and 5.6, which is essentially the baseline bed net use. So only about 6% of these houses were using their bed nets at baseline. But after getting a free bed net, through this coupon scheme, and then the ownership went up to high 90%. But interestingly, the incentive houses, the houses where we told them we would give them a bonus after we showed up after a month, 99% of those houses were using their bed nets after 1 month, compared to only 78% of the houses that just got a free bed net. So this suggested to us that providing an incentive could drive use and could induce people to use their bed nets perhaps more. Additionally, we went back at 6 months to see how things were going, and you can note here that how the solid line went from 99% use and actually decreased a little bit after 6 months to 93% reported use after 6 months. And interestingly, the dotted line went from 78%, actually increased up to 90% use after 6 months. So that might suggest that that 99% initial boost from the incentive might have been somewhat artificial. People using their bed nets because they knew they might get a prize. Just so you know, the prize that we gave out was household goods. We gave them a couple dollars worth of rice and coffee, some household goods that were of value, soap and those sorts of things. So this was an early study that got me interested in bed net use. And one potential lesson from this is that incentives, and this has been seen in many other behavioral incentives related to health, they seem to be short-lived if they're inducing you to do something that perhaps you don't want to do anyway. However, there is this differential use that I called it, which is essentially bed net use, protection for children that would not have occurred without the incentive. So perhaps there might be some value in using pulsed incentives, for example, or incentives for high-risk situations like pregnant women, for example, that could actually have a real impact. Haven't really pursued that much more, but that was another initial study that I was involved with. So as I mentioned, this got me interested in this idea of bed net use, because as I mentioned, having a bed net is one thing, but you need to use it regularly in order to prevent malaria to the maximum that a bed net is able to do so. So, nowadays there's a lot of money. I showed you that 221 million bed nets were distributed, last year throughout the world. So there's a lot of money invested in bed nets as sort of what we call like the pillar of malaria prevention. But we actually don't know a whole lot about how bed nets are actually used. And part of the reason for that is that the way we measure bed net use is limited. Mostly because bed net use occurs late at night in someone's house, and it's difficult to measure that. So the most traditional methods for measuring bed net use are what we call self-reports. So mostly in surveillance, where you're going around, to different houses and trying to see the effectiveness of your latest distribution campaign. You'll go to a district and visit a few houses that you've randomly selected, and you'll say, "Hey, did you use your bed net last night?" So that's a very easy way. It's a low impact. It doesn't take a whole lot of skin off people's back to answer that question. There are some biases in there, and we'll talk a little bit more about that and potential challenges with self-reports. Other ways that people have used and that I've used in some of my other studies are visual observations. So you say, "Did you use your bed net? Oh, great. Would you mind if we took a look and saw where it's hanging?" And you can actually see whether a bed net's hanging over a bed or not. Is for just if you haven't slept under one, typically, these are these nettings. I'll show you some more pictures in a little bit, but they typically have to be hung by strings to the ceiling or to the wall so that they can actually hang above a bed. And so it takes some effort to put those up. So that's maybe another way of trying to confirm whether people are using them regularly or not. Another way to measure that's been used in the literature, and I've used myself as well, are unannounced night visits, where you show up at 9:30 at night and you obviously in a research setting where people know that you may show up, and you ask them, who's under which bed net, and you can actually get a sense of whether people are using them or not at certain times of night, for example. And then finally, there actually are studies where they've done nighttime observations, where they have either study individuals, or sometimes they'll have household members be seconded to essentially watch what people are doing when they get under the bed net, whether they put their bed net down during the night. And that's additional data about how these bed nets are being used. You can imagine how some of these latter methods are a little bit intrusive and maybe impractical. So I mentioned some of these traditional methods are imprecise. So one challenge with kind of the self-report measures is that they're one time. You show up at a house and you may get how that household's using their bed net at that one time. And you might miss seasonal variations. This is very well established in the literature, in particular countries where malaria is very seasonal. You have a dry season and a wet season, or dry and multiple wet seasons. People use their bed nets differently depending on how many mosquitoes are around or how many mosquitoes they perceive are around. And so one-time assessments might miss some of that variation. In addition, you get intranight variation. So if I ask someone if they used their bed net last night and they used it for 1 hour, they might say, yeah. Or, they may have used it for 10 hours, but got up 3 times during the night to, use the restroom or check on a child. And they might have gotten exposed to malaria when they're coming out from under the bed net. So there's a whole bunch of variation and a whole bunch of interesting behaviors that occur within households that all have implications for malaria risk. And so, like malaria transmission intensity, a lot of these variations are what I call locally determined. Every household is different from other ones, and every village is different, and different countries and different cultural behaviors come into play that all have implications for malaria risk. In addition, I mentioned some of the biases, self-reporting bias. Self-reports may overestimate use. And, for example, this is a study that I did in 2018. It was a meta-analysis where I took, 18 different studies that had measured both at the same time or close to the same time a measure of self-reported use and one of those other objective methods, like they confirmed that a bed net was hanging over a bed, or they actually did nighttime, unannounced visits. And the idea was to compare what the estimate was from self-report versus what the estimate was from a more objective method. And, not surprisingly, self-reports tended to overestimate Bednet use by about 13% over the actual objectively measured Bednet use. And part of that is, understandable. If I am part of a campaign that just went into your village and provided you all with a bunch of free bed nets, and then I go back another, a month later and I ask you, are you using your bed nets? You can imagine the tendency to perhaps occasionally overestimate your use. So coming out of that study where I was providing incentives for bednet use, again, that was all just based off visual observation of a bednet hanging over a bed. I wanted to look more closely at ways we could find better ways to objectively measure whether bed nets were being used and how they're being used. So that's what got me into this idea of developing a bed net monitor. So the idea is that, you see this bed net here on the top photo, that's an unfurled, we call it, or unfolded, it's folded down, essentially a bed net that's deployed for use. And then you see these two bottom photos are two common ways that bed nets are stored during the day. So in many of these houses that, people live in a single room or a couple of rooms, they actually use the bed area for eating, or kids are playing. And so they'll often, we call fold up the bed net or tie up the bed net during the day so that it doesn't become damaged by all the activity that goes on in the room. And so one idea was to use a tool that could measure objectively, without a bias, whether the bed net is actually unfurled for use or folded up. At the same time, perhaps we could measure some interruptions in use, measure when people are coming out from under the bed net. So the motivation behind this was that we could perhaps come up with some new metrics. So we used to just ask people, did you use your bed net last night? Which, as I was mentioning, is very imprecise. But maybe we could come up with a metric like how many hours was the bed net used on average last night and the 10 nights before. Maybe we could come up with metrics about like what time the bed net was put down and what time the bed net was folded up in the morning. Or maybe we can look at seasonal changes, as I was mentioning, in bed net use, with the idea that these all have implications for malaria, mosquito exposure and malaria exposure. So we're trying to develop some new metrics and ways to look at malaria risk. And then I mentioned some interruptions per night. People that get up to, as I said, to take care of a child or use the restroom during the night. Those are all potential occasions for malaria exposure, and it's important to understand those and understand the natural limitations of a bed net. So this was the original tool that I developed that I was mentioning before. It's called the SmartNet tool. It's so just to explain, in panel A here, you're seeing a typical bed net with some added material. And that material that you're seeing there, the gray part, is actually conductive fabric. So it's actually fabric that if you send a very small electronic pulse through it, you can detect a current. The yellow is actually just added for aesthetics. And the idea was that we created these bed nets where when the bed net was folded up, it would act as a tripwire, and actually you'd be able to detect that a circuit was completed and that the bed net was not in use. It was actually folded up or tied in a knot, as I showed you in the previous picture. So this tool actually worked quite well. It could last up to 8 weeks. On its own with just 2 AA batteries. We would integrate these tools into WHO approved bed nets. Ones that had the correct insecticides, and the price wasn't bad, around $120 for a research tool. It was quite useful. We'll talk about, you can imagine some of the downsides, which we'll talk about more in a little bit. But for what it was one of the first tools of its kind, and it was quite useful. These are some other pictures of the ways we tried to make the bed nets attractive for people to use. So we started out, as you should with most technologies, doing some acceptability studies. The first study we did in 2016 was we were in Malaria, which is in Western Uganda. And we basically approached mothers or first-time pregnant women in a clinic, and we approached them and just showed them the tool. We showed them the bed net, we showed them that device, and we said, this is what this device would do. What do you think about it? It was a low risk situation for them. They were just being asked questions. They didn't actually have to use them. Most everyone said that they thought it was looked acceptable to them, and they would be willing to try it. They like the appearance of the fabric patterns. It's attractive. It makes it kind of jazzes up your room a little bit if you don't have as many decorations. There were some challenges, acceptability challenges around the appearance of the device. So I was mentioning, it looks kind of electronic-y, and what exactly is this Bednet monitor? What is it actually measuring? Those kinds of things that in a research setting you can spend some time and explain to people, and you can help make sure that they're educated and feel comfortable. But showing people the device, the general opinion was positive. So next, we actually did a pilot study in 10 houses in Barara in Southwest Uganda. In that study, we put one SmartNet in a house and asked them to use it over a regular sleeping area that was used regularly. And we asked them to just use the SmartNet like they would any other typical Bednet. And the device measures the state of the Bednet every 15 minutes. Through the night and through the day as well. And we did this study for about 6 weeks per household. So it's 6 weeks per 10 houses. In addition, we overlaid a qualitative sort of acceptability component, and recently got that published just last year. That was generally positive as well, again, with similar comments about the electronics and other things, which, as I said, we'll talk about a bit more later. So this is actually, you're looking at the raw data from 10 houses. And I think the main thing to take from this, each of those lines, each chart, it's the number 1, 2, 3, 4. These are each house, along the columns there. And on the far left side, you can see 1800 to 9 a.m. So that's 6 p.m. in the evening, through the night into 9 a.m. the next morning. And then that's along the y-axis, and along the x-axis, you're seeing days. So every time you see a line or a missing line, that's a day of observation. And I think the main thing to take from this is that even in a small sample of 10 houses, you see a wide range of behaviors. You see a wide range of different ways of using bed nets. So you take number 1, for example, they use their bed net pretty regularly, then they just missed a day or two, then they kept it down for a whole day or 3 days in a row, and then they missed for more. So what this, and then, a whole range of those kind of behaviors, missing bed net use, or just leaving their bed net unfurled all the time. So what this suggested to me is that there's a lot of variation in bed net use, which is really interesting to think about and look at. These are some other metrics. I was talking about these different metrics. This is the proportion of bed nets that were in use by night hour. Unsurprisingly, as it gets later at night, more people are asleep, and so you can see more bed nets are in use. But you see a range here, like household number 3, had their bed net up 100% of the time from 10 p.m. till 6 a.m., whereas household number 6, only got up to about 75% of the time. So there's a big range in bed net use, and it's important to remember that all has implications for those individuals' risk of acquiring malaria. And this is another metric. These are interruptions in use during the night. And so what we define this is once the bed net goes down sometime after 7 p.m., then each bubble here is the clock time at which the bed net was put up again. And then the size of the bubble is how long it was actually put up at that time. And so and each color it's a different household. So some households, like household 10, had no interruptions, and other households had many interruptions. Perhaps they had young children. But again, this is all data that can be analyzed and measured up with mosquito exposure, which is what I'm going to talk about in a little bit. So, I guess I'm talking about it now. So how can we use this information about how people use their bed nets to understand their risk of malaria, and then with the ultimate goal of how do we improve, how do we prevent more malaria? before I get into this, just, I think one analogy that I often use is toothbrushing, right? This is something, like toothbrushing, we recommend it to our patients or our family members to do that every day, right? And so Bednet use is very similar to that. And you can imagine that there's a whole range of toothbrushing behaviors that occur, in the world. Some people brush their teeth once every 3 days. Some people brush their teeth, religiously twice a day, 3 times a day. So you can, just like you can imagine a range of behaviors in toothbrushing, you can imagine a range of behaviors with Bednet use. But again, Bednets are the only tool we have for most children to protect them from malaria. And as I mentioned before, malaria for young children can be quite risky. So this study was more recent in 2019. The idea here was actually to use these SmartNet devices that are measuring Bednet use, regularly every 15 minutes throughout the night, and also measure mosquito exposure. So we deployed SmartNets in 20 houses in eastern Uganda. Now this is a different setting than that prior setting. This is actually a setting with much more malaria. And what we did is we covered every sleeping area in the house with a SmartNet. And we additionally were doing concurrently, we were gathering what we call entomology metrics, which are measures of mosquito exposure. We used 2 different ways of measuring mosquito exposure in this study. One is called the CDC light trap, which is essentially a trap that every 2 weeks we set up in every room where people are sleeping. And it just runs throughout the night and sucks in mosquitoes, essentially. And throughout the night, you get a total count of how many mosquitoes were in that room during that night. An additional tool we use is called human landing catches. So these are actually where we have individual volunteers that stand in the house and just outside the house during the night with a flashlight, and they're actually watching their leg for a mosquito to land on it. And they're using a small aspirator, and every time a mosquito lands in their leg, presumably to bite them, they suck it up and store that mosquito. And what that adds, that's essentially the gold standard for malaria exposure. That adds additional information about the timing of biting. During the night, how often, how many mosquitoes were trying to bite you at 9 p.m. versus 2 a.m. And so we were doing those in different houses than where we did the CDC light traps, but in a region nearby with very similar exposure. And the idea here, and this is actually the main goal behind my current funding, my K-23 funding, is to actually look at gaps between how people use their bed nets, all those behaviors I was showing you before, and vector exposure when the mosquitoes are around trying to bite you. So not surprisingly, there was something that's not surprising in the malaria world, but it's interesting if you haven't really thought about it much. Bednet use is very age dependent. So, children under 5 are typically thought of as very good users of bed nets, probably because they're not necessarily using the bed nets themselves, but they have their parents watching out for them. Again, you can think of that toothbrushing analogy. In addition, as I mentioned before, children under 5 are well known to be at high risk of malaria. So again, a group that would be motivated to use bed nets. School-age children, however, and young adults were actually much worse at using their bed nets. And so in this study, we found that children age 5 to 15 are about 2 times as likely to miss a night of bed net use compared to children under 5. And young adults, 15 to under 30, were 2.5 times as likely to not use their bed nets on a particular night. Missing a night of bed net use is a lot of hours of exposure, and depending on how many mosquitoes are around that night, that's a lot of potential mosquito exposure. Interestingly, in this study, children under 5 and adults over 30 used bed nets very similarly. Again, probably a measure of how the parents are looking out for those young children. Also, they're, in these smaller houses with lots of people, there's a lot of bed sharing. Children are sleeping with their parents, and so there are 2 or 3 that might be reflecting that as well. But what we're able to do is then using a sort of an estimated model of your total number of mosquito exposures per hour, and then matching that up with whether or not the bed net that you typically used was being used at that hour. We were able to identify for each person a total count of mosquitoes that they could have potentially been exposed to. And essentially, we by using reported bedtimes, timing of mosquito biting, and this bed net use, we determined for the population as a whole that the bed nets were only protecting against from about 50% of potential exposures, which is pretty low. The people were getting exposed before they put their bed nets down. They were getting exposed during interruptions in their bed net use, and they were getting exposed on those nights when they forgot to use their bed net or for some other reason didn't use the bed net. What you can see here in this chart is that the number of mosquitoes averted by bed net use was higher or the percent of mosquitoes exposure averted was higher in the younger children, again, because they use their bed nets more and go to bed earlier. And then it goes down to the older adults. So for the older adults, even though they use their bed nets similarly to the under fives, they tend to go to bed later. And so that's why they were only getting about 50% exposure protected by the bed nets. But this study, I think, is an example, and this is some of the work that I'm continuing to try to do, which is looking at the intersection between human behaviors and mosquito exposure, and what can that tell us about the type of interventions that we need to be using. So next, I was going to talk quickly about some progress we've made in improving the SmartNet monitoring. So as I mentioned, some of the challenges around it, obviously the way it looks, it's very conspicuous. You know you're being monitored, and not only do you know because you're in a research study, you're reminded of it every time you look at your bed net. In addition, so that may change how you act. In addition, it was a little complex. This was, built from scratch, with, contractors and stuff. So it took us a long time to develop the device, and it was a little bit complex. The battery life was, not ideal. 2 months is, 8 weeks is okay, but I would have liked it to be longer. And then there were some issues around tampering. There were like memory cards and things you could take out of it. So we wanted to come up with a better way of monitoring bed net use objectively. So one potential solution to this was using accelerometers. So this is the Gene Active device. This is a device that's typically wrist worn and then used, it's kind of an activity monitor. This is specifically designed for research studies, for, obesity studies, those sorts of things, activity studies. You may be familiar with some of those. What we found is that by taking the watch bands off and actually just taking that little watch face down there at the bottom, we could attach these to bed nets, and by using a machine learning algorithm, actually determine how that bed net's being used. The advantages are that it's less obtrusive, so it's just a small little watch face on your bed net instead of that whole get up we had before. It's water resistant. There was less tampering, diversion, and actually can last at least 3 months, sometimes longer at a go. So one study I was involved with was trying to test the accuracy of these devices. So it was a study done in Liverpool with Liverpool School of Tropical Medicine, where they actually had individuals come into a controlled setting and mimic the use of bed net, mimic the use of a bed net. By applying a machine learning algorithm that I helped develop, we're able to show that, determining whether the bed net was up or down is very accurate, about 96%. And then when you actually add in kind of those interruptions I was mentioning, people slipping out from under the bed net or coming into a bed net that's already unfolded, it was still quite accurate, around 83%. So this accelerometer is kind of what we've transitioned to as a better approach for measuring bed net use. So what are kind of the lessons that I've been able to draw from this work around bed net use? Basically, bed net use varies with mosquito density. So most usually around perceived mosquito density. So even though in the dry season, there may not be very many malaria vectors, malaria risk is still not zero. So the teaching is that people, the education we try to provide is that people should use their bed nets all the time. You can imagine if I told you that you had to, use the bed net all the time or you're going to get malaria, how inconvenient that might be. And that's a real issue, is that people can't live under bed nets. I mean, you can't always have a bed net around you, and they're annoying. And so that is a challenge that we're constantly, battling with in terms of trying to find a tool that is more effective and also more convenient for people to live their regular lives. Age is a significant factor, as I mentioned, in bed net, lack of use of bed nets. Children under 5 and adults seem to use their bed nets similarly. School-age children are classically the problem. They use their bed nets overall for 2 hours less per night. So that's a lot of exposure over, we were doing this study, I think, for it was 4 months. So what that suggests is, that school-age children are known to not use their bed nets very well. And actually, they tend to be a significant reservoir for the malaria parasite, because as children grow older, they tend to not get fevers, they tend to not get as sick, but they still have the parasite in their blood. And actually, they can then transmit the malaria parasite to other people, to young children. And it's actually a big issue around trying to get school-age children to use their bed nets. And then that was, shown to be an issue, once we objectively monitored how they were using their bed nets. And then, really interesting to look at different use by hour and when mosquitoes are around, when people are using their bed nets. I just get really excited about trying to think about human behaviors, which was, a lot of my research early on. And now I'm adding in a lot more about vector behaviors. And it's just really fascinating trying to figure out, where people are getting exposed, because it only takes one bite of an infectious mosquito to get malaria. So you have to be able to prevent those bites a lot. You have to prevent as many bites as you possibly can, essentially. So what are some next steps that I'm working on? And then we'll get to some questions. You have some. First of all, why is there such wide range of behaviors? Why do some individuals, why do some houses use their bed nets frequently and others just aren't interested? So I've been trying to do some qualitative interviews. I actually have about 34 qualitative interviews that we performed in our study group to try to answer those questions. In addition, we were able to, I'm excited about, is interview kids down to age 8, which really hasn't been done before in bednet use. So try to get the perspective to the degree we can from young children about what they think about their bednet use and why they're using their bed nets and who's helping them use their bed nets. And there's a whole other field that I'm working in and trying to improve the accuracy of these accelerometers and tools. I have a couple of proposals out to try to improve that machine learning model that I discussed, to try to improve the accuracy of the accelerometer monitoring. In addition, I'm really interested in trying to design a specific device. The specific device is much smaller, much cheaper, that is just built for measuring bednet use. So those are some things that I'm working on. And then we've got multiple field studies going on that I'm involved with. I have, as I mentioned, my study in Uganda that's been going on with about 15 houses that now this is another iteration where we're actually been watching them for over a year. So we'll be able to get some of the seasonal changes there and a whole lot of mosquito exposure that we've gathered at the same time. There's also a study in Cote d'Ivoire that I'm doing, working with, that's funded by the Gates Foundation to use these devices. And then finally, I'm working on a study in Cameroon to try to use these devices. And for countries like Cameroon, for example, bed nets are all they have. So in Uganda, we use things like insecticide spraying inside the houses, and they have other tools. In Cameroon, all they have are bed nets. And so they're very interested. They're very interested in understanding how the people are using all of these bed nets that they're spending, millions of dollars to distribute. So I think this is a useful tool for that. So conclusions, important to remember that malaria was still a significant cause of child mortality in Africa. It's really been stagnated over the last almost 10 years now, 8 years. and it's really settled in Africa among African children. Bednets are one of the most widely distributed tools for health promotion worldwide, I feel comfortable saying. They've been very effective, but in recent years, we don't know enough about how they're being used, and we're having new challenges around insecticide resistance that, require us to think more strategically about how we can use these bed nets to be more effective. And as I was trying to mention, is that there's a lot we don't know about how human behaviors, mosquito exposure intersect, and a whole bunch of individual, cultural, community behaviors that play into this that I'm excited about looking at. That's my mission statement again. So thank you very much for your attention. I'm really excited to present here. And these are some of the groups that I work with more recently, but there's been many people that have helped support a lot of this work. So with that, I'll stop, and I'm happy to take your questions. Thanks so much.
Great. Well, thank you, Paul. I really appreciate you taking the time to present us with all that work, and it's really quite interesting. Maybe I'll start with a question, and then we'll see if other people have questions. So, I've just been sort of thinking about what you were alluding to, which is, why aren't people using them more religiously? And it strikes me that, there's a couple of thoughts as to why that might be the case. One might be that, people may not be convinced that it's such a big deal if you get malaria. But more likely, perhaps, is that they're not convinced that it's really going to make much of a difference because, mosquitoes don't just bite you when you're sleeping. They know that they get bitten at other times as well. And some of the data you showed suggests that even under the best use, maybe you can reduce the number of bites by 50% or so, but it would suggest that people are eventually going to get bitten by a mosquito that's going to give them malaria if they're living in a malaria-prone area. And if they've concluded that, and I figure, people are smart, if they're not using it, I'm guessing they're not convinced that it really makes that much of a difference. So are they right about that? Or not?
Well, that's a very good, very astute question. I think that so what I haven't gotten into.
By the way, why don't you stop sharing so we can all see each other?
Oh.
You can if you can.
Oh, sorry, you can't see it again. Sorry. Yes, I'm on my screen. There you go.
Thanks.
Yeah, no problem. So yeah, that's a great question. So what I mentioned a little bit about the insecticide resistance. There are multiple new types of bed nets that are having more of an impact in recent years than the traditional pyrethroid is the type of insecticide that was being used previously. And so if people had perhaps intuited that the bed nets were not being as effective, there are more effective bed nets coming, and that's been shown in a couple different trials in Africa. But I think that part of the challenge is that malaria, for you or I, if we were to get malaria, that's a big deal, right? It's very dangerous for people that don't have any immunity. But we have to realize that in a lot of the regions, at least where I work in Eastern Uganda, kids are getting 2-3 cases a year every year. And so that's how they develop their immunity, so that by the time they're in school age, they're not getting, febrile and having convulsions and being as high a risk. So I think that's a very important point, is that it is sort of seen as the background, is that people get exposed to malaria, people get malarial fevers very commonly. Now, not every fever that people get in these villages is malarial, right? I mean, kids get fevers from plenty of other sources, but it's definitely the impression is that malaria might be just part of life. And so that is another barrier to getting people to use their bed nets regularly, even while we're giving them free ones, right? So that's why those behaviors are something I'm super interested in. But that's a really good point.
And what do you think? Do you think even if you could figure out a way to get people to use it as religiously, would it really solve the problem, in your opinion?
No. In my opinion, from what I'm seeing, I think that especially that study that I showed you, only 50% of exposures were averted. I think that we were really living off before, the effectiveness of bed nets was living off that community-wide effect that I was mentioning, where you get this insecticide introduced to a village and all of a sudden the mosquitoes just get knocked down. The density of mosquitoes drops significantly because they're all dying. And I think nowadays, because of resistance and because of less use, they're not getting knocked down as much. And so I think that bed nets aren't as effective as they used to be. And even some of these newer ones won't be as effective as they used to be. And so that's part of my research. The truth is that the malaria community doesn't want to hear that, because there's a whole lot of momentum around bed nets. But as I was mentioning, people can't live under bed nets. It's never going to prevent 100% of exposures. And so there's plenty of research into other alternative tools, but to be honest, there's not a lot of really great ones, certainly not as effective as bed nets have been. So I would say that I'm a little bit skeptical that bed nets are going to, even with perfect use, answer the whole question.
Great. Well, we have a couple of minutes left. Does anybody else have any questions they'd like to ask? Paul? Yeah, Jim.
Paul, thanks so much. I have a behavioral and a technical question.
Great.
The behavioral question relates to the way you employ feedback. Classic feedback to modify behavior, reduce C-section rate, showing people the classic studies on coronary bypass performance and things. How have you approached feedback behaviorally? And the technical question is, I expected to hear wireless monitoring.
Yes. So I'll take the technical one first. So I think wireless. So, I have a computer science background. I know just enough to do what I presented to you, but there's a whole bunch. I mean, we're all holding iPhones or smartphones in our hands. There's a whole lot of technical advances we could make. I think part of the issue has been getting people excited about it, funders essentially excited enough to pay the money to engineer some of these tools, but we're getting there. And in more recent studies, and now I showed you some of those other groups like Gates and PMI, President's Malaria Initiative. These are big movers, big funders. They're getting more interested in this tool. So I'm hoping that will move us towards wireless monitoring and a whole lot of other, and engineering advances we could make. In terms of the behavioral monitoring, behavioral feedback, so one of the best ideas I've heard is actually developing a tool like this that almost just, reminds people that there's mosquitoes around, or a way of actually, I haven't really used this tool much as a way to purposely change behaviors. Just having the device in your house makes you use the evidence I have makes you use your bed nets more than you did before. But there's definitely a way, especially now that I'm getting this tool or this approach out to more houses, of doing feedback, for example, showing people their bed net use patterns. I think that's what you're alluding to. And that would be probably a very powerful way of, showing people when they're forgetting to use their bed net, or the hours that they might think about fitting into their routines a little bit better to use. So those are really great ideas.
Well, especially given what I understand to be high penetration of cell phone use in Africa.
Yep. Yeah. No, it's a tool that we have. We call it mHealth. It's a tool that we've had that we hadn't had before. There's a whole realm of using these. Part of the challenge has been cost, honestly. But if we could get them down to be cheaper, there are ways we could use these even as a teaching tool, like you're mentioning, and find ways to help promote their use, use them as an intervention themselves.
Thank you.
No, thank you.
Well, I'm going to have to drop off, but Stefan looks like he had a question he put in the chat. And if you have a few minutes,
yeah,
perhaps you can answer that question. And I want to just thank you again before I drop off.
Yeah, it was great to meet you all. Thank you very much.
Yes, thanks.
Thanks, Paul. This was awesome. So my question, which I put in the chat, was so it seems that the hemoglobin seems to be protective against malaria, or like sort of severity. Yeah. Does that play a practical role in your life, sort of on the street? Meaning, do families?
Yeah. So we look at this. Yeah, we look at it in. So my main group is we actually have a cohort of about 80 houses that we follow. So we do a lot of work. So I guess that's a sort of it's a group that we spend a lot of time with longitudinally. We don't do, I'm not working a lot in huge populations where that might have more of an impact. The sickle cell here is, much higher prevalence, as you would imagine, than we would see in our typical populations back in San Francisco. It doesn't come into play so much in terms of the bed nets, because essentially the approach has been just more bed nets for everybody, more, give everybody. But there's some really super interesting differential risk related to sickle cell, and that's something that our cohort has looked at a little bit.
Thank you. Very good work. Congratulations.
Oh, awesome. Thanks for joining. Appreciate it. I think I'll sign off. Thanks, everybody. Unless
Bye.
anybody else has any other
All the
questions.
best.
Appreciate the time. Thank you. Thanks, Eve. Appreciate it.
Bye.